Queen Brenda here. This is a tip for hospice nurses who visit their patients in assisted living or memory care units. I'm in those places a lot. And they have to have very clear instructions on medications for the med techs to administer them. And not all hospices provide the same comfort pack, but it is very common for most hospices in their comfort pack to provide at least two medications for anxiety and agitation. For instance, lorazepam and Haldol. My tip is when prescribing these medications in these settings, try to only have one PRN available. For instance, on a mission, if the patient's pretty stable, I'll write for PRN Haldol and say, hold lorazepam until hospice initiates. And then as things advance, say they're in their dying process and we are using both, then I only have one PRN. For example, I'll schedule Haldols 3 or 4 times a day, and then I'll have either routine and or scheduled lorazepam. So the lorazepam in the dying process, for instance, is the PRN. Facilities run into a lot of problems with regulations when they have more than one option, so the caregiver then or the med tech has to decide which one to use. And also it's more confusing for these med techs who don't get sometimes a lot of training, just having one PRN available. And that way there's less decision making, and we tend to have a little bit more control of the medications and what's going on. So that's my tip for hospice nurses. And get a copy of our booklet, the Hospice Care Plan. For hospices, we have a 2-hour crash course for this booklet, going through medication, symptom management, and the dying process for helping educate hospice nurses newer to end-of-life care. Thehospicecareplan.com. Thanks.